just onto another big issue, which let's keep it brief if we can. Health.
Oh.
And now there's been a lot made about, well, there are two issues, local issues here. The one is the building of a new hospital, which the Prime Minister announced the other day that they're going to build a new hospital. National will say that actually, well, they wanted to do it last election. And the other issue, which I know is a hot topic for you, Mark, is a 24-hour medical facility in Napier, which doesn't have it at the moment. So we'll start with you on those two issues.
Right. So, well, I'm pleased to be able to, on the side of the argument that we're going to be building a rebuild of the Hawke's Bay Hospital.
Where's the money coming from?
Where's the money for that?
Well, it's in the budget. We've budgeted between 700 million and 1.1 billion for it. And it's in the
Prime Minister said it's coming from the infrastructure fund that they have for hospitals and schools.
Right.
So to be clear about investment in health, we've spent 6 times as much in 6 years as in the entire 9 years of the Key government on the fabric of our hospital system. We inherited a hospital system. We inherited a hospital system where 20 separate health boards had been systematically underfunded, were carrying debts and deficits, and there was literally poo in the walls in some of the hospitals in Auckland, because when you set a small number of targets and focus on those, and you don't look at the entire infrastructure of your health service, it decays. And so I think, all Kiwis will know, if they really think about it and look into their hearts, they'll know that under National, health and education always slide backwards. Teachers and doctors and nurses, their relative pay in society slips under National governments.
Oh, look, let's look
and
into
the
investment, future, Mark.
We are still building Dunedin Hospital, which should have been built in the Key years, right? We are always behind on health when we get in after National. And so the positive thing is, if Labour's re-elected, we will continue to increase the investment in health infrastructure. And I will be arguing as a local MP for a slice of that, for us to have 24/7 services. We have the difference between this time and when National promised it is when we got into government, they hadn't funded the hospital, just like the last 2 times they promised a 4-lane highway for between Napier and Hastings. They didn't fund it then either.
When we promised it, we weren't actually in government.
Yeah.
You still have to cost your policies.
We did.
You didn't.
Do you believe the new hospital should be built? And what do you think about what Mark says about a 24-hour?
Yeah, I agree with the 24-hour service, the better service for Napier, because Gabrielle showed that we were isolated. We need something there that people actually get proper treatment in. And if we're isolated from Hastings and the only option there is going to be by helicopter, we need to be able to provide emergency services. Flooding is going to be, we've got earthquakes, but there are other natural disasters that will cause problems for Napier. The hospital, brilliant. If we're going to get a new hospital or new hospital services, I would still like some of that sidelined more for Napier. I'd like to see it spread across our district. The other thing we need is hands on deck. We need all those people who were cut from the health service due to the mandates, the vaccine mandates. I'll go back to that and say they should be reinstated, apologised to, and back into the hospitals. We need hands on deck, and they ought to be apologised to for being pushed out from the workforce.
Yeah. So, Julian, how do we get that workforce? How do we get those skills to be able to populate our hospitals and provide these services?
Okay, well, obviously, I also agree about the 24/7 Napier health service, and I'm really pleased about the rebuild of the hospital. In terms of how to get you need to be increasing pay and conditions for medical staff so that they don't go to Australia, so that they're much keener on staying in New Zealand to do the job. You need to be obviously recruiting more people from overseas as a short-term measure, and you need to be training more of them. So you need to be investing more in the training budget for medical services. And just a couple of other things I'd like to say as well.
Very quickly, please.
Yes, is about investing in health promotion and disease prevention initiatives, which is a real Cinderella of the New Zealand health service. We need to be investing more in that, so we're actually not having to pay so much for acute care. I'll leave it at that.
Yeah. Laurie, health service.
Yeah, health is pretty much a nightmare in Napier when the cyclone hit. And again, it needs to have something in Hawke's Bay. Obviously, a building's fine, a nice building, but it's the staffing. We have just got like 2,000 or 3,000 nurses have left.
New Zealand First doesn't want anyone to come into the country. You don't want
No, the statement is bring in who we want, not who wants us. We need to put a list of what the people need, because how many thousands of nurses have left? And they've been arguing, they've been struggling over trying to
putting
get
up your
extra
pay
pay,
60%
and yet
is
they'll
helping.
they'll spend 90 billion on a light rail. Why don't we just use some of that money and use it wisely? Start to think, instead of putting a $90 billion light rail, there hasn't been an inch of track laid. Why don't we start looking at our people who really need to run this country? We need nurses, we need doctors. They've got wards in Auckland Hospital that they can't operate in. They've got doctors, they've got nurses, they don't have an anaesthetist, so they can't do the operation. We need the resources in the country.
So, Katie, Labour's stealing your idea for
Yeah.
hospital, you reckon?
Yeah, well, look, we don't argue about needing a new hospital, but I think the priority,
Just
like
need to
our
do it
other
when they're in
candidates have
government.
said,
Staff.
like our other candidates have said, that we need the numbers of staff. And the same goes for a 24/7 medical centre in Napier. I'm a strong advocate for that. That would be amazing. But our spokesperson for health, Shane Reti, Dr. Shane Reti, who would be an incredible health minister, he did an overnight shift at Napier Medical Centre and he said, Katie, it was appalling.
When was the last time?
There is not one person there that could prescribe medication. So the person that comes in overnight that needs support, they have to pay to go back to a doctor the next day to get their prescription. It is outrageous. So
Katie,
we
when was
need
the last time National
numbers.
built a hospital in government and just didn't talk
But
about it in
Jules,
opposition?
It's about health outcomes.
Healthcare.
It is about our health outcomes. You could have the shiniest hospital out there, and we don't disagree with that, but you need the people inside it
You need
first.
to invest in the health system.
You cannot operate, and we are.
You
year
need to
on
invest
year,
in the
we are
health
going to
system
increase
over
funding
successive
to health
governments.
Year on year. We need to make sure we are achieving outcomes.
The
And
last time-
currently,
the
this
last time
government
National
has not had one
had the
better
health system-
outcome for everything that they have done. And if you talk to staff in the current health system, they are crippled. They cannot do their
Pavel,
job.
What's your solution to the health
Well,
situation?
obviously it's a good idea to
Privatise
have
it,
new
obviously.
hospital in Hastings, but the problem is that it's highly suspicious that Labour finally saw the light 3 weeks before the election and announced the hospital. We remember
Every
light rail.
election you see
Have a
that in your
look at
policies for
Dunedin
that.
Hospital, which is being downscaled all the time. That was last election's promise. You have a long track record of promising what people want to get
At
some
least we
votes
built Dunedin
and
Hospital.
not
It was
delivering.
supposed to be built a lot earlier.
Meanwhile, in Hastings, there is a private hospital.
So you privatise health. Here we
Private
go.
workforce has got so frustrated with the way things have been over the last 6 years
Yeah.
that they walked across the road and actually built the hospital for themselves. And already there is publicly funded procedures being happening in this hospital.
Which is a good
Okay,
thing.
so what Act is saying, like with the roading infrastructure, the way to accelerate delivery of such infrastructure is to involve private capital.
No, it's to
it's
do
working
both.
in the UK, it's working in other
to do
countries.
both.
And this is
think
the only
involving is doing
sustainable
both.
way to actually have a hospital as opposed to just promise a hospital 3 weeks
Okay.
before the election.